Hi, doctors, students of homeopathy, and friends of homeopathy. Today, the 1621st day of uninterrupted daily webinar of IFPH is about to begin, and today's our guest is Dr. Mukesh Musale. He is a young, dynamic, passionate homeopathy consultant and counselor with vast experience of advanced, acute, severe, pathological, and chronic cases with ability to give results within a short duration with homeopathy. He do have an MD from IBAM Medical College, Kolkata, PGDCR and RA from Birmingham, UK, BA Psychology from YCMOU, Nashik, PGD, Behavioral and Clinical Psychology. He is a director of Dr. Musli's Healing Pearls Homeopathic Clinic, Nashik. He is the president of Nirakaran Foundation, NGO, working in the field of social work for needy peoples and for poor and needy patients. He is a tutor for workshop at Aditya Homeopathic Hospital, Pimpri, Pune. He have done lot of seminars and webinars. Awards and achievements also is a lot with him. He had on 2013 National Samatha Fellowship Award, 2017 Best Practitioner Award by Lions Club Nashik on the occasion of World Doctors Day. And he got Healthcare Excellent Award, Young Homeopath by Divya Marathi and Dainik Bhaskar Group in the presence of Rural Development Minister, Honorable Dr. Dada Guze, Public Family Welfare and Health Minister, Honorable Mr. Egnath Shinde was also present. Assam Book of National Record, March 2021 award. His awards also ranges a lot. He was invited by Guru Gobind Singh College of Engineering, Indiranagar, to deliver a lecture on homeopathy, a scientific and modern method of treatment for hopeless patients. Also, he done a lot of sessions also in several institutions. And today, the topic of discussion is how to deal autoimmune and irreversible pathological cases with a simplified way of classical homeopathy. To learn the approach, understand miasm and potency. Let's welcome Dr.
Hello, sir.
Yeah, please.
Good evening to all.
Good evening.
Yes. So, should I share my PPT?
Sure, you can, sir.
Yes. Is it visible?
Yes.
So, good evening to everyone. I'm Dr. Mukesh Musale, practicing in Nashik since last 15 years. Today, without wasting your valuable time, I'm going to discuss with you my clinical experiences, my clinical cases, how I deal with acute emergencies. I start this session with Guru Vandana with Dr. Samuel Hahnemann and my living legend Guru Dr. Amarse Nikam sir, who is having his 100-bedded homeopathic hospital at Pune. I worked there for 2 years and then I started my practice. And after that, I learned many experiences. I learned many things from my patients also. So today I'm going to discuss with you several cases like intracerebral hemorrhage, ependymoma, ganglionic cyst, xenoderma pigmentosum, squamous cell carcinoma, Gerson-Gopalan syndrome, PCOS with secondary infertility, tracheoesophageal fistula, squamous cell carcinoma, epileptiform convulsions, Hansen's disease, dry gangrene, and I worked in the field of animals. I give homeopathic medicines to animals also. So how it is possible with the homeopathy? So today I'm going to share with you all. So my first case for today's session is intracerebral hemorrhage with ITP. So it's an autoimmune disease. ITP, everybody knows, idiopathic thrombocytopenic purpura. That patient was suffering from ITP since 12 years. After that, he had undergone 2 craniotomic surgery, and then he landed into a critical condition. So ventilator, he was on ventilator. And after that, I got a call from senior most homeopath from Mumbai, and she called me, and she said me that if you is it possible for you to give some medicines or to cure this patient, how we can help. So after seeing this video, I was having only 10 to 15 minutes to work out. And then after 15 minutes, I give her reply. I suggested a medicine with a potency 30, and we got the result within an 8 hours. So we will discuss this case. It's a very interesting case. He was having accelerated hypertension after craniotomy, aspirational pneumonia, and immune thrombocytopenic purpura. So case as follows. As I discussed with you, the patient was in comatose condition on ventilator, BiPAP support, and intensivist planning tracheostomy within a few hours. If he did not receive homeopathic medicine at that period of time, then the condition was the scenario may be different at that time. He might shifted to permanent ventilation, and the more than 20 days or 30 days on ventilator. But fortunately, he received homeopathic medicine, and he uh, survived, and he secured his life with the help of homeopathy. So we'll see. These are the reports, MRI reports. See, diagnosis was clear cut here: intracerebral bleed with accelerated hypertension, with aspiration pneumonia, with idiopathic thrombocytopenic purpura, under an intensive critical care management with the antibiotics, osmotic, diuretic, steroids, blood products. Transmission, almost 3 to 4 transmission was done, and on ventilators respiratory support. A decompression craniotomy was done previously, and after 2 craniotomy, he was under this condition. So this is a scan of brain. Ill-defined hyperdense acute hemorrhage in right occipito-temporal lobes cortex and subcortical white matter extending into posterior parietal lobe surrounded by multiple small foci. Why I am reading this? Because these impressions, MRI or CT scan, are very important for us to find out the miasm. We can't prescribe without miasmatic influences or without miasmatic background. So this is very important. Is another scan report. See, the after this, there is an impression, no new lesion is seen here. This is 7th March 2022 report and 11 March 2022 report. You can see here no new lesion is seen. Now we will see how was the patient's condition when I had a call from that senior homeopath. See, patient was on ventilator support with a BiPAP. I took history, short history, and I prescribed medicine. I just asked that doctor, just give him XYZ medicine in 30 potency and see the result within 8 hours. See the result. So homeopathy is very fast. Just what we have to do, we have to select a proper similimum medicine. After 15 days, patient had discharged from the hospital, and I had a talk with that intensivist also, because he was saying this is a miracle, but I said this is not miracle, this is science. See, after 15 days, he was at home. This is follow-up after 1 month. Just observe body language of the patient. Previously, how was condition of the patient, and now how he is walking. We can't say that he was undergone 1 month before, 2 months before the craniotomy, or he was in comatose condition. This is homeopathy. After 3 months, patient came to meet me at my OPD and he gave me testimonial, video testimonial. Now he is sharing his views. He is explaining his condition at hospital, at ICU. How was the condition? After giving that medicine is too similimum that at 14/3/2022, his platelet count was 14,000. At 15/3/2022, 61,000. At 17/3/22, it's 85, and almost 1,18,000 at 18/3/2022. Now he is in my contact right now also, and there is no downfall of platelets till now below than 1 lakh right now also. This patient is taking my treatment in since 2022. Now he is not on my medications, but he is in touch with me. So I'm asking him to go for regular CBC and other scans and other things. So this is the small information which I received from the patient, from patient's relatives and their doctors. The 34 years old male is on ventilator. Before intubation, he was having severe abdominal pain and was lying on abdomen, feeling better. So continuously talking that he wants to go home and talking about his shop. She told me this happens very slowly, but having direct impact on brain after craniotomy surgery. This is the main information. This is the entry area where we need to work out. So this is the small information of physical general desire, sweat, thirst, extremely thirsty patient, hot patient, elements from recent overexertion, so mental exertion, hobbies, to do research in financial knowledge and business development, very dedicated and firm in his decision during business development and in the field of business. As I was having previously told me, very less time, less than 30 minutes to analyze the repetize this case. So I prescribed medicine in 30 potency and proceed further to the rubrics as follows. So I concluded this within a 5 minutes. It's right-sided medicine with right-sided symptoms in CT scan also and MRI. Hot patient, extremely thirsty, dryness of mucous membrane, business talks of or industrious, delirium, talks business about and wants to go home, pain in abdomen, ambulation, lying on painful side or by ambulation by pressure. These are the PQRS symptoms which I collected from the patients. determined, desire, sweat, 2+, elements from overexertion. Complaints develop slowly but forcibly. Pneumonia, intracerebral hemorrhage. So I consider sphere of action of the remedy, mental symptoms, physical generals, thermal, sides of the remedy, and then I prescribe. So thermal, patient thermally hot. So in this case, every case, I give importance to thermal as it relate to our thermoregulatory mechanism of the body, which is controlled by our hypothalamus, which give us direct clue to the medicine, and we can easily filter other medicines while selecting the similar. So thermals are hidden in drug modalities. Every drug expresses their thermal sensations and thermal modalities according to atmospheric weather changes. So that's why the thermal is very important. Many times we prescribe medicine only on symptom similarity. We are not considering thermal. So according to my knowledge and my experience, it is wrong. So these thermal medicine modalities are related to patient's comfort and discomfort feeling, and also depend on their individual cellular metabolism. So patient's comfort and discomfort feeling and cellular metabolisms, when we unite this and give and consider the thermal, then our medicine should be of similar, definitely. So this is a small repetition chart. As I repetize in my mobile synthesis, mind delirium, home wants to go, mind talking business of, stomach thirsty, stomach thirst large quantities for, abdomen pain lying on abdomen, ambulation, general side right, general's food entering sweet desire 2+, and warm aggravation, that is a hot patient. So I selected bryonia in 30 potency. With repetition of dose after every 10 minutes till the response of the patient. So within that 8 hours, I asked that doctor to repeat every 10 minutes, because patient was on comatose condition, is a ventilator support. It's an acute condition. Dr. Hahnemann told us, and during acute condition, we need to repeat frequently. It depends on your experience, how to repeat it. So after 8 hours, when I received positive response from patient, I asked doctor to repeat medicine after 2 hours for next 1 day. And after that, I withdraw medicine, and afterwards only SL. So this is a repetition chart. You can see here medicine. So bryonia is having action on serous membrane and viscera, is indicated in changes in blood, affecting its quantity, its quality, and its circulation, causing inflammation and exudation. It disorders circulation, producing congestion, alters blood, giving rise to typhoid, bilious, and remittent type of fever. So if during fever, we can think of this sphere of action. Dryness of mucous membrane, hence discharges are scanty, pneumonia, and vicarious bleeding. And even bryonia is acting on our brain area. It acts on ventricles and medulla oblongata also. During intracerebral hemorrhage, bryonia acts wonderfully. So these are the types of brain hemorrhage which we should know. Epidural hematoma, subarachnoid hemorrhage, subdural hematoma, and intracerebral hemorrhage. So this intracerebral hemorrhage, we have 3 main medicines: bryonia, phosphorus. Phosphorus is having oozing discharges, but it's acting on intracerebral hemorrhage and lachesis. In subdural hematoma, we have all bleeders like Crotellus horridus, Crotellus cascavella. Epidural hematoma, again we have bryonia, then gelsemium, and subarachnoid hemorrhage. We have lachesis and phosphorus. So this is my first case to share with you. This is an autoimmune disorder with this very critical pathological case, and patient was on ventilator. So you can dare to take such type of cases. Only the thing is that your basics should be clear. You should balance the totality, and afterwards you prescribe medicine, then you will get a wonderful result. So my next case is it's again a rarest of rare tumor, which we call as ependymoma. This was a rejected case by allopathic physicians, neurosurgeon and neurophysician, because what happens in ependymoma, it's a rarest of rare tumor which occurs in our ventricle and spinal cord. So the main funda of ependymoma is main pathology is it's arising from epithelial cells of ventricles and the spinal cord. So during that pons and medulla oblongata is also involved. So there are very less chances of successful surgeries. So neurosurgeons are again they are fearful while attending such patients, and they are not taking risk of doing such type of surgeries. So this is the case where homeopaths, as a homeopathic neurophysician, we have a scope. So I solved this case within a 3 months of period, and I got very fast results with the help of our medicine in homeopathic medicine. I prescribed only one medicine at one time, and I got very good results. And I came to know that how homeopathic medicine acts from start to end. So there is no, we can say there is no 2 to 3 medicines mix. There is no mother tinctures. There is no biochemics. I used only dilutions, and mostly I use 30 potency. So see, we will see the case. So already I told you ependymoma is a growth of cells that forms in the brain and spinal cord, cells from a mass called a tumor. So ependymoma begins in the ependymal cells. These cells line the passageways that carry cerebrospinal fluid. This fluid surrounds and protects the brain and spinal cord. So in this case, we need to select a medicine which is having a sphere of action on ependymal cells, which is having action on spinal cord and also brain. So fact is that it's a very interesting case because it's a rare tumor. Only 1% is affected, 1% in a 1.5 lakhs of peoples. So that grows in the brain and spinal cord. Very challenging because it's an ependymoma. If you had if you had chance to meet any neurophysician and you if you talk with him, you will come to know this is very challenging cases. So very risky case to deal with. So for this treatment in allopathy, the first treatment for an ependymoma is surgery. If possible, the goal of surgery is to obtain tissue to determine the tumor type and remove as much tumor as possible without causing more symptoms. Because when neurophysicians operated these patients, then there are 85% chances that patient become worse. And the today's case, was the same. This case was operated in Bangalore, and afterwards that patient becomes very in bedridden, very worst condition. And after that, I took this case, and I got a very good results. So the pathology is this tumor is derived from layer of epithelium that lines the ventricles and the central canal of spinal cord. It occurs chiefly in childhood and young adulthood. That is mostly we can see these patients below 20 years of age. Typically, is encountered in the fourth ventricle, posterior fossa tumor. So it is well demarcated tumor, but complete surgical removal may not be possible due to close proximity to vital structures like medulla and pons. So there are two types of variants of ependymoma. It's a myxopapillary ependymoma. It's characteristically region occurs in chorda equina and originated from phylum terminal in adults. So you can see here is this is the myxopapillary ependymoma, and the subependymoma, it's asymptomatic incidental solid nodule in the fourth and lateral ventricles. You can see here or this lateral ventricle, we found the subependymoma. In my case, both ependymoma was present. She was operated for this subependymoma, and she left for myxopapillary ependymoma. These are the reports. Patient name Tejaswini Sontakke. Impression was here. Large, well-defined, altered signal intensity, smooth, expansible, heterogeneous, enhancing endurable mass. This finding raise possibility of neoplastic etiology, that is myxopapillary ependymoma. Here also mentioned, this is the second follow-up MRI. So these are the reports, and now we will go ahead with case study. So according to our routine format, I took the case. Patient was on bedridden. Patient contacted with me from more than 220 kilometers from Nasik. So I took this case on video call. I took this case with the help of patient's father and mother. So the first complaint, heaviness of limbs, numbness since 4 months, hands and legs, numbness, this numbness sensation, aggravation, dry cold air, change of weather, movement and by touch, ambulation by hot application, by rest. She was having pain in lower back since 4 months. Location, lumbar region, sensation, dull aching. Aggravation again, stooping, this bending forward, lying down and hot application, ambulation. She was having loss of balance, cannot walk and stand, unable to hold things properly in hands since 4 months. She was having neurological issue at the bladder, having pressure while passing urine since 3 to 4 months, and having dribbling type of urination. Foot drop, right side, lower limb. So right to left shift of complaints, which I observed and I noted. So my observation in case, I observed patient was bedridden during first video call, unable to wake up, unable to walk properly, imbalancing while walking. I see having a tottering gait. That's a type of waddling, tottering gait during walking. After operation, all complaints are increased. During conversation, she was not having faith in medicine, anypathy, very reluctant to talk on her disease. These sentences are very important. Just have a concentration on these symptoms and sentences. Hopeless about her recovery. I observed that the patient was bedridden during the repeatedly unable to work. After the operation, all of these complaints worsened. During our conversation, she expressed a lack of faith in medicine, any form of treatment. So was very reluctant about her illness and seemed hopeless about her recovery. So this picture before starting of disease, she shared me and she asked me that, doctor, please give me my original constitution, give me my original temperament, makeup. She sent me this photo, and after the surgery, she was looking like this. See the difference? This was before starting of disease, when she was very comfort, a disease-free state. After the disease, she landed up into this condition. So this is her first follow-up. I guess she sent me this follow-up after 12 days. After 12 days of medicines. This is second follow-up. After 2 days, that is 14th day. Patient was not able to walk. She was bedridden. But after receiving homeopathic medicine, see the results. And after 3 months, she came to meet me. She traveled with a red bus of Maharashtra, which was very hectic journey actually. She can able to manage this journey. She's sharing her experiences in Marathi. She's a 21-year-old lady. She living in Dharangaon, which is almost 220 kilometers from Nasik. She consulted many doctors, 2 to 3 senior homeopaths, but she was not having any results. And afterwards, she's climbing stairs of my OPD. With a single support of right hand. See, her tottering gait is also resolved. And now she's sharing her experience. She's explaining her sensation, her complaints in Marathi, what she was suffering from. So after treatment, this is her recent photograph after 4 months of treatment. See the difference. She asked me that, doctor, please restore my previous health. So this is the restoration of health with the help of homeopathy. See the difference. Now she can able to walk. She can walk for more than 1.5 kilometers without any support. So continue with our case. Physical generals, she is thirstless, desires spicy, aversion for bitter, sweet, 1 plus. Thermally, patient is chilly. Food aggravation, sweet and sour. Mind, irritability due to pain. Brooding tendency, timid, hopeless about recovery, absent-mindedness, and ailments from mental exertion and grief. So my totality is irritability due to pain or irritability pain during, brooding tendency, timid, hopeless about recovery, absent-mindedness, elements from grief, mental exertion, thirstless patient, desire spicy, aversion to sweet, thermally chilly patient, heaviness of limbs, aggravation by cold air, change of weather, pain in lower back, aggravation by stooping, amelioration by hot application, loss of balance, cannot walk and stand, unable to hold things properly in hands, dribbling of urination, force is very slow, foot drop right side of lower limb, and I saw there is a right to left shift in her complaints. And one thing, my observation, during my observation, I observed a tottering gait. So, any guesses from you about medicine? You can type so that I can know about the medicine. Very simple and polycrest medicine. I will wait for 1 minute. If no reply, then we will go ahead with medicine. No problem. Or 20 to 30 seconds. Yes. Victus. One reply from Victus causticum. From Dr. Ram Pravesh Shah. Phosphorus. Dr. Chandrika Mohan ma'am. Calcarea carb. Dr. Noor sir Lycopodium. Dr. Ushali Wakre causticum. Sevgi pulsatilla. Dr. Razina causticum. It's good that you are Dr. Dhirendnath Tiwari, Apis mellifica. It's good attempt. Very good. Yes, we have wonderful reply, that is calcarea carb, causticum, phosphorus, Apis mellifica. So we'll go ahead with our medicine. Medicine is very simple, but approach is very difficult because we need to think, we need to have a different reading from different books to conclude such cases. So this is repatriation chart. Patient name Tejaswini Sontakke, and my medicine is causticum. 2 to 3 doctors said very correctly. Mind brooding, despair, recovery of absent-mindedness, thirstlessness, desire for spices, aversion to sweet, cold aggravation, that is chilly patient, extremities, heaviness, lower limbs, back pain, stooping aggravation, sorry, bladder urination, dribbling, elements from grief, prolonged, extremities, tottering gait, and right to left shift. So my medicine is causticum 30 potency. Why causticum? So we have causticum sphere of action, acts on nerves, motor and sensory, on muscles, voluntary and involuntary of bladder, larynx and limbs. This is only one approach, but I balanced the totality, and after that I prescribed medicine. So to get our miasmatic background, which is the miasm involved in this, that's why we need to know sphere of action of the medicine and pathophysiology. So weakness, progressive loss of muscular strength, causing increasing uncertainty of control over the muscles, finally ending in paralysis, of single organs or parts. So paralysis from exposure to cold or damp weather or wind, so we can think of causticum. Causticum pathology is the main the central theme is it's acting on central and peripheral nervous system. So there is a development of a gradual paralysis in causticum. So main idea of causticum is gradual paralysis following an initial phase of excessive hypersensitivity and overreactivity. So there might be possibility of convulsive attacks during first few hours of causticum patient during disease state. So we can also we should also inquire for this if there is a history of convulsive attacks before starting of disease or after operation. This will also guide us for causticum. So references for this, I used Kate's Repertory, Class Mater Medica, Allen's Keynote, Fatak Mater Medica, Complete Repertory, Synthetic Repertory, Volume 2, Organ of Medicine, Comparative Mater Medica by Dr. E. F. Farrington, The New Research in Manifestation of Miasm by Dr. Nikam sir, and Research in Thermal Mater Medica by Dr. Nikam sir. So this was my two cases. First case was autoimmune disorder and another having irreversible pathological changes. So I shared with you my two cases. So how homeopathy is evidence based. So I have some cases with you. Just go through it. It's a very short period. So you can just think on it. So according to me, homeopathy is very fast. It acts within a few seconds, few minutes, and few hours. So this is my clinical experiences. I was having patient of ganglionic cyst. He was asked to be operated for ganglion cyst, but he came to me from Pune, and I give him medicine Silica 35 doses per day for almost 3 to 4 days, and results within 7 days. See the ganglionic cyst totally recovered. Says there is no need for operation. This is again another case of xeroderma pigmentosum. It's an autosomal recessive disease. These patients are very tricky and very risky to treat because we need to know the pathology. Many times we need to have an continuous conversation with their dermatologist also to have that our medicine is perfect or not. There every patients every time they test you, so you need to have knowledge about pathology medicines and your mater medica too. So I prescribed him alumina 30 repetition after 10 days. I got results within a 10 days. So this is before and after photos. This case of a squamous cell carcinoma, CA buccal mucosa. In this patient, I prescribed Nux vomica repetition 4 to 5 times in 1 month. I got results within 1 month, and I have having a video of patient. He was saying that after taking homeopathic medicine, before this homeopathic medicine, he was very he was not too much religious. He was fed up of his disease, and he was not having faith in religion or in God. But after homeopathic medicine, he started his meditation. He started this regular puja, and he developed a faith on treatment. See the results. He took more than 20 cycles of chemotherapy, but there is no improvement. So Gerson-Gopalan syndrome with plantar psoriasis, erythromyalgia, and hyperkeratosis. I prescribed causticum 30 repetition for 3 to 4 times in 3 months duration. I got results within 3 months. You can see before, during the first month and second month, and after 3 months, see the result with the help of homeopathy. So this is causticum medicine. Causticum is acting on Gerson-Gopalan syndrome also, and in ependymoma case also. But approach patient is different, and our approach should be fixed one. Medicine is same, but acting on different regions. This is a case of PCOS with secondary infertility. With the help of arsenic album, I got results within 15 days. This is a very tricky case, tracheoesophageal fistula, and he was having ASD, atrial septal defect, 7.7 millimeter. And this is a 2021 case. And after giving antimtat 30 repetition 2 hourly, within a short period of time, I got result within 72 hours. See the condition of the patient. This was, I think, during second wave of COVID, where that oxygen cylinder was not easily available, but this child was regularly requiring oxygen cylinder. See, you can see here, that's my OPD's waiting room. This is ambu bag, and they are giving oxygen 6 liter per minute. This is the condition of the patient during ICU when he was admitted in ICU. But after receiving homeopathic medicine, see the joy of the patient. He is not requiring any oxygen. See the first video and the third video. And she is with her mother. Her mother is a BMS doctor. Another case of squamous cell carcinoma, CA tongue. It's before treatment and after treatment. In fact, in this patient, I got results within 8 days with Lacasis 30. This patient is continuously in follow-up with me right now also, and they are doing very well. This I guess this patient 2021 or 20. Another case of epileptiform convulsions. This was before treatment. The actual convulsive attack. They are giving nasal spray. And after taking homeopathic medicine, this is video testimonial. She was saying at the age of 6 months, she was suffering from convulsive attacks. And after taking homeopathic medicine, after 3.5 months of medicines, I got result within 3 days. But after continuous regular 3 months medication, after that, there is no single episode of epileptiform convulsions. I prescribed Sina 30. This is another case of leprosy, this Hansen's disease. I prescribed Sepia 30. You can see the result. You can see the lesions of that patient. in leprosy, this was a bite by a rat, as they were not knowing it's functionless. And after treatment, see the result in the patient. So Sapia 30 acts wonderfully. This before treatment video of patient, almost 8 to 9 kg weight gain after homeopathic treatment. See the body language, see the changes. This is another case of irreversible pathology. It's dry gangrene. During this dry gangrene or wet gangrene, they asked for amputation or plastic surgeries, but I had several patients of this gangrene. I prescribed arsenic album 30 repetition 4 to 5 times in 3 months. See before treatment, after giving single dose, first dose, see the result. This is third follow-up, fourth follow-up. This is a reappearance of blood flow. You can see here. Fifth follow-up. It's a new development of nail. You can see here. It's a lady finger. Sixth follow-up. Seventh follow-up. Restoration of health as very small amount of gangrene is left in his finger. His hands, legs, hands and legs, everything was involved. So blood flow increased in affected part and healing start accordingly. So this was a gangrene case. And lastly, I had prescribed medicines to animals. I had a camp of 22 gir guys, 2 nandis and almost 25 buffaloes, and I prescribed homeopathic medicine to them. And I got a wonderful result in infertility cases and eczema. I got good results in lumpy disease. Before 2 years before, there was a epidemic of lumpy disease in these buffaloes and cows. So I give them medicines and it was wonderful results. I'm prescribing medicines to animals with a free of cost. There's no charges. So that's it from my side for today. This is my Twitter, LinkedIn, Instagram profile, Facebook and YouTube channel. You can connect with me if you have any questions. My personal mobile number. And to conclude for today's session, this my experience I want to share with you that I give importance to body language of patient, modalities, that is aggravating and ameliorating factors which guide us for proper selection of medicine. If you miss any aggravating factors, if you miss any time modalities or any weather modalities, you miss the whole scenario, you miss actual simillimum. So stick to our basic principles, stick to proper case taking. If your case taking is good, I called it as a case receiving rather to take a case. It's case receiving. How the patient is explaining, just take it. So this is receiving, and just go ahead with that. It's patient's language, then convert it into a repertory language. A complete symptom, I give importance to grand generalization. It's physical generals, thermals, and by considering physical, mental, pathophysiological, thermal, and miasm, give us simillimum. So according to me, the scope of homeopathy is here. See, we can avoid operative measures, we can avoid long stay in hospital, we can treat pathological and autoimmune cases at OPD level, with the help of a only single dose or single medicine. In acute condition, we have to repeat. So according to me, 30 potency is a safe and minimal potency, minimum repeat with minimum repetition. The effectiveness of 30 is that if we prescribe higher potency, then there are many hazardous conditions. We can get when Kent's 12 observation, but even 30, there is no need to worry. It's very safe potency. We can immediately change another medicine if our medicine is fail. If we think that we prescribe wrong medicine, then we can change in 30. But it is not with higher potencies. Its work, homeopathy works in acute and pathological and irreversible cases also. So that's it for today.
Thank you, Dr. Mukesh. It was a very wonderful, excellent, fantastic session. And it is really motivating us, the real path where how homeopathy is working wonders in emergency cases. It's just mind-blowing. I know a lot of persons will be here to speak with you, but the time is not now right. So you already forwarded the Instagram page and how to contact persons with you. So if there is any query, you can directly contact Dr. Mukesh. And it's now time to wind up. So I know it's the persons will be having eagerness to talk with you, sir. So if you have another session also to host.
Yes, I am planning to go for an acute fever cases.
It will be great. IFPH will be always welcoming you to come back to this floor. Yeah, thank you. Thank you. On behalf of IFPH, I am paying the thanks to you. Thanks for the session. Come back again. Thank you, Doctor.
Thank you, sir. Thank you.
And thank you all for participating in this session. And tomorrow we will again meet in the same time. Over to Malayalam, Dr. Manoj.
Thank you, Doctor.